Hello, again, my name is Chris Deibert, and I'm the director of the Men's Health Clinic here at Nebraska Medicine and UNMC. And I want to share with you a little bit about male sexual survivorship. And this is something that I'm passionate about and helping the men that I see get back to what looks like, in some ways, a new structure and a new normal for them. So who am I? Well, I'm a urologist here at Nebraska Medicine. I have some extra training in male fertility and sexual function. And the main parts of my practice are focused on sexual function, fertility, testosterone type issues. And you and those joining here today may be a cancer survivor, maybe the spouse or a partner of a survivor, a friend, advocate, provider, or just someone who's curious to learn a little bit more about this area of survivorship. And so I welcome you to this section of the day. We're going to talk a little bit about the frequency of different sexual concerns after treatment. We're going to look at some of the sexual issues that men particularly face. So my practice is about men, so I'm going to keep this focused on men almost exclusively. The evaluation that I walk men through, and then some of the treatment options. And of course, at the end, I welcome any of your questions. So a survivor is considered anybody from the time of diagnosis through the entire rest of life. And hopefully that's a long time. And that care includes obviously treating the current cancer and preventing new ones, keeping a close tab for surveillance based on the type of cancer. And then I think where really I can step into part of this is looking at one aspect of the psychosocial effects, including on intimacy and sexual function, and trying to help from the after effects of any cancer treatment. And then also helping to play a role as being one of the specialty providers for men that need my help. So sexual function and fertility issues can be quite common for men after cancer therapy. Many of the cancer modalities do have a negative impact on fertility, and that is across the age spectrum for both children diagnosed and treated with cancer, as well as young adults and even older adults. So fertility is always a top of mind issue for me, hopefully met and talked about in the pre-treatment setting. Sexual function can change a lot over the course of cancer therapy. There could be concerns or questions about body image changes for some men, actual function changes as far as how erections and sexual desire are altered because of treatments and time. And we really just want to make sure that we ask about those concerns for men before we start to develop clear treatment plans alongside of them. So sexual health is a quality of life issue in my mind. This is across the spectrum of our life, and it matters in the realms of desire, arousal, erection function. It's affected by so much of what's going on in our life, right? This is a conference on cancer and survivorship, but that's just one aspect of who you are on a medical checklist. Right? You're a complex person. You've got social things going on. You've got your personal intimacy within the context of your relationship. There's medications for medical issues outside of cancer therapy. And then, as I mentioned before, body image, hormone changes, et cetera, that all play a role in your sexual health. And unfortunately, there's still a lot of barriers surrounding this, right? When you're in the midst of your cancer diagnosis and therapy, very appropriately, that's the main focus for you and for the providers, doctors, nurses taking care of you and that of your loved ones, right? Let's get the cancer, let's treat it, and let's move forward in life. The sexual health, though, still is often present during those treatment times, and it certainly can become present once the active therapy is behind you and you get ready to move more into the survivor mode and focus on the rest of your life without cancer. There's a lot of discomfort for people talking about this, whether it's you, the doctor or nurse that's taking care of you, your partner. It may not have been something that you spoke about outside of the confines of your home before. So there's just some general discomfort for some people. And I hope that today is one step in eliminating that barrier for you. And to be clear, that's on the part of the provider too, because we really want to focus on things that are upfront and really critical. And sometimes this is relegated into a secondary or tertiary concern for patients. Please be certain, if you have a fear of being taken seriously or how legitimate of a concern this is, It is. It does matter. And it's part of taking care of a holistic you. Sometimes we make incorrect assumptions too about your age, about your sexuality, about your orientation, about your desire to still be intimate, about how the surgeries you may have had impact your body image. I haven't been through all of this. You have. So we want you to engage with us and help understand what your personal experience is with that. Help us make sure we're not making the wrong assumptions about what your needs are, and then meet your needs, whatever they may be. So any cancer alone can cause it. I'm not even at treatment yet. Just having cancer can be enough to cause some sexual dysfunction for men and women both. And that's because some of the cancers that we look at, right, rectal cancer, prostate cancer, those are very closely invested with the nerves and the blood vessels that help with erectile function, for instance. And so just the fact that there's tumor growing in that space can negatively affect sexual function. Different types of blood cancers, up to 30% of men are going to have erection changes because of how the cancer is moving through the body in that way. But really, in the end, we don't know who and how and exactly to what severity men are going to be affected simply from having cancer. Now, once you get treated, whether that be chemotherapy, radiation, surgery, any of those things, again, can affect the nerves and vessels that are really important for establishing good erection function. So just very specifically, how can they affect it? Well, chemotherapy for some people can result in hormone changes, certainly fatigue, weight loss, hair loss, and just being frankly too tired to be intimate can be a sexual health issue in the course of your treatment. Weight and hair loss can affect body image, how you perceive yourself, how you think your intimate partner might perceive you as far as your sexuality and attractiveness. All of that can go into these perceptions about sexual concerns after or during cancer treatment. Radiation itself, especially if it's down lower in the pelvis and the lower part of the abdomen, that can directly affect nerves and vessels related to erections. And we know that for all of those cancers, rectal cancer, prostate cancer, et cetera, that there can, for many men, though not all, but many men have negative impact on their sexual function, both short-term and long-term. Surgery in particular, again, if you're moving or cutting any of those vessels and nerves in the pelvis, you certainly can cause both short-term and longer-term injury. And again, right, you're going in there, you're trying to get out the cancer, get this thing out of the body. And in some ways, kind of willing to do that however it takes so that you get good cancer cure. But also, at least in urology, when we're working in that area a lot, we try and be very aware of the nerves and vessels there and sort of gently push them out of the way, trying to maintain as much function again in the future for men. But this is a tough trade-off sometimes to get the right cancer and the right long-term sexual function surgery done all at the same time. So any of these therapies might also result in a lower testosterone production. And testosterone is pretty tightly tied with sexual desire, energy, mood overall, and for some men, erectile dysfunction as well. And so this is just one other avenue in the hormonal area where sexual issues can arise after and during cancer treatment. So what are some of the big causes of erection concerns? Well, for a lot of people, even before any cancer therapy, if they have diabetes, high blood pressure, other sorts of vascular diseases, perhaps other medications they're already taking, any of those can already be risk factors for erectile function. And then additional surgery that we may do for your cancer, other treatments, radiation, et cetera, as we've talked about, may also contribute to this. So sometimes it's multifactorial with a lot of different inputs that all build up and in the end result in poor erectile function than where you were at the start of this journey. How do erections function normally, right? We can't help if we don't understand how it first can go wrong. So here, quick picture, a diagram of the penis. The two larger areas up top are what normally fill with blood and help a penis stand up with erection. At the end, the blood all drains back out of the penis and back into the body. So anything that affects the blood flow or the nerve input to this area obviously can result in impaired erection function overall. So how do we assess that? Well, one, it's driven by you. So if you on your own, you and your intimate partners have had significant erection changes for whatever reason, then let your doctors know, let your providers know, because it's only if you first speak into it that we can start this process for assessment and then for treatment and getting you back towards a place where things are functioning closer to where you'd like them to be. So how do we assess? One, we measure it. And you tell us what it is, and then we ask questions about it. We have a number of different questionnaires that we use to assess this with you, and that helps get an objective number of where you are right now. So one really common and simple one that I use is called the erection hardness score, and it's just this simple. It's sort of a rating scale with 4 different domains on it, as you can see on the screen here. For really severe erections, the penis might be a little bit larger, but not all that hard. It might be hard, but not quite hard enough to have sex. A score of 3 means, hey, I can have sex. The erection's pretty good. It's definitely not a full erection. And 4 is, hey, this is a great quality erection for me, and I'm doing well with it. Again, pretty easy way to score this, just to get a good sense of where things are at for you. And then in addition to the actual score objectively, I also want to know how bothered are you by that, right? So if your erection function is worse now than it once was, but you're still sexually active, you're still satisfied, your partner is still satisfied, there's not necessarily anything that you need to do about this. However, if you're bothered, if your partner's bothered, then certainly there are a lot of tools available where we can help you. So some different areas for this. I always like to break down treatment options as far as first, lifestyle changes that are possible, second, medication opportunities for improvement, and third, sometimes surgical interventions to help. So what are some lifestyle modifications? And a lot of these won't be a big surprise because these are things that we talk about all the time as far as achieving better health. So smoking cessation is a big one. Pretty good data that if you stop smoking, there can be improvement in your vascular function, especially with regards to the penis, and you can restore some erection function in that way. Getting to an ideal body weight. This may be losing weight for some after significant cancer therapy. This may mean gaining weight again and getting back up to your ideal body weight. Regular exercise, which for those fatigued during the therapy can be tough to come by. But getting into a regular exercise habit again has data-driven proof that erection function can be, if not restored, at least improved. For those with diabetes or who develop diabetes over the course of their treatment, better sugar control and glucose control can make a very substantial impact on erection function. And then finally, for those with high blood pressure, maintaining good blood pressure levels also contributes positively to erection function. So these are some specific, but also sort of generalized body lifestyle treatment of other areas of the body that can help with erection function. And this is typically where I like to start with patients as far as getting them an upgrade in their holistic health. So what if those things aren't working or in conjunction with those options? Well, there may be a role for checking testosterone levels for men. As I said earlier, hormones can be affected by some cancer therapies or just with the natural change in testosterone with age. And so checking those levels, correlating that with sexual function and other symptoms may make some men a good candidate for testosterone therapy to help improve their sexual function as well. And then there's lots of other treatment options, and I'm going to touch on these briefly here. So the mainstay for a very long time has been oral therapy. And these are medications well known to many of us like Cialis, Levitra, Viagra, those sorts of medications. Generally well tolerated. You take these an hour or two before you plan to be sexually active. And for many men, they work well. They don't, however, work well for everybody. And in those cases, we move kind of on down this algorithm and use some of these other options. So there are injections, believe it or not, direct liquid injected in a very small amount directly into the penis can make a fantastic difference for some men in their erection quality. There's something called a vacuum erection device. It's an external device that helps to bring blood flow into the penis and then keep it there. You remove the device and have a good quality erection for about a half hour or so. Sometimes talking to a certified sexual therapist can help. Particularly important if there's other psychological stressors that may be playing a role here, including body image or sensory changes to help bring both a person and a couple into a different viewpoint of their intimacy after therapy. And finally, there's some surgical options where we basically put a prosthetic implant inside the penis to allow a man to achieve an erection again that's satisfactory for intercourse. So when does somebody need to seek all this? Well, I'd encourage anybody at the outset of therapy to already be talking about what the norms of their intimacy are and then how that changes over the course of their treatment. If you're already beyond treatment and in the survivor phase, well, at that point, it's whenever you feel ready to, right? You and your partner, ideally. And of course, it's safe from your recovery standpoint. Although I would submit that I think there's very rare occasions where it's unsafe for men and their partners to be sexually active during the course of therapy, except for perhaps just after surgeries. So let's touch just briefly on how some of these different treatments actually work and what they look like. So the oral medications that we talked about, essentially these block a normal enzyme called PDE5 in the body. And by blocking that, instead of the blood vessels getting more narrowed, as we see on the screen, it allows the blood vessels to expand, filling with more blood and encouraging better blood flow and better erection quality in the penis. The majority of men are able to have intercourse on this therapy, but again, it doesn't work for everybody, and there are other options available. This vacuum erection device, again, this is just sort of a pictorial description of this thing. It goes on the penis. A little band at the bottom of the screen here is slipped off onto the base of the penis. That's what traps all the blood there. And that can remain on for about 30 minutes before the penis needs a break and needs some fresh inflow of blood, and that has to be taken off. The injections here, just a picture representation of it. Very small needle injected into the base of the penis. This is excellent for guys in that the vast majority will be successful with this, and the onset's very quick. Oral medications usually take 1 to 2 hours before they start working. The injection usually works in a matter of minutes instead, which can sort of alter the flow, if you will, for an intimate experience. And then the surgery, right? This is if nothing else is working. Again, we can take an implant device, surgically put this into the penis. The most common device, men would pump this part of the instrument right here between the scrotum. And again, this is all internalized at the time of the surgery. It fills the penis up with fluid in the device. The man can stay erect for as long as he wants to. And then he depresses a button inside the scrotum here again that causes all the fluid to go out of the penis to become flaccid again. Typically, there's very good patient and partner satisfaction with this. I'm always very careful in my counseling for men to let them know that all this device does is give you back good, firm erections. The penis does not look quite the same because, as you can see, the device doesn't fill all parts of the penis. It may have a little bit different sensation for you and your partner as well. And importantly, it does nothing to affect orgasm or ejaculation. So if those were present before therapy and before this surgery, they'll likely be present afterwards, but it's no guarantee. Either way, this is a great option when nothing else is working for a guy and he still desires the opportunity to be sexually intimate. So the American College of Clinical Oncology has some really great recommendations here for all of us as providers. And that is firstly to discuss with all of our patients their current sexual health and any dysfunction or changes over the course of treatment. That just lets us get some insight with you. And then try and understand if there's any psychosocial interventions for individuals or couples. And again, this could be counseling, this could be sexual therapy for them, to try and treat erectile dysfunction wherever it can be treated, and to check a testosterone level. All of these things recommended by the major oncology association here within America, and hopefully being offered and applied to all patients here locally as well. So to help overcome some of the barriers that we looked at before is really, just as many of you did with your actual cancer therapy, is to take ownership of this, right? Become a knowledge expert, consume information where you can, and ask questions. Bring it up to your doctor. Bring it up to the other providers taking care of you. Bring it up to the nurse who's checking you in, who may communicate that to your physician to try and get you some help. And then really be willing to try a new option, right? Oftentimes everything going into cancer care is brand new, from how you had a biopsy to all these new scans that are happening, to the surgeries, the chemos, the radiations, all things you likely never encountered before until it became a major issue for you in your life every day. And so you tried a lot of new things then with the goal of being cancer-free. And here are some other options to help you become the best version of the survivor that you can be as well. Obviously, if you have a regular intimate partner, it can be helpful to discuss this with them as well, as far as their continued engagement and interest, making sure that they don't have a misunderstanding or misperception of what your ongoing interest and desire is, and then working together, within that couple dyad to seek out better intimacy together. And then again, after all this therapy, this may look different for you. And understanding that while our goal is to be as restorative as possible, that's not always something we're capable of doing. And this entire intimate experience may just look and feel different. That doesn't negate the experience or diminish the experience of intimacy and sexual health. It's just an acknowledgement of what the reality is for lots of patients after their care. So some next steps to take after this experience here today. Again, first of all, talk to your partner. What are your goals? What are your partner's goals? How do those align? Where do you need to get alignment together? Talk to your doctor. Talk to the PA or nurse practitioner or nurse that's helping take care of you to seek out some therapy, some assessment, and help you get to where you want to be. Obviously, as urologists here at Nebraska Medicine, we are always happy to meet with patients who have additional questions, additional concerns, and help you get back to where you'd like. Because again, this is your sexual function, and that matters most importantly.